Yeah, hello, my name is Prince from NCLEX Swift, and today you are welcome to my YouTube channel. Recently, I've been getting a lot of questions from people who want to write the NCLEX exams, and I've gathered the most frequent one being asked by these people. Okay, all right. So let's go through the questions. What is NCLEX? That's the first question we are going to answer today. The second one is who can write the NCLEX exams? The number of questions to answer during the examination, location of the examination centers. Is there an age limit to the NCLEX exams? Countries that require you to write the NCLEX. Benefit of writing the NCLEX exams. Does one need an English test report, for example, IELTS report, before writing the NCLEX exams? And lastly, can midwives write the NCLEX exams? So stay with me. Let's go through each question one after the other. All right, so if you need NCLEX private tutorials, everything related to NCLEX, you can contact us on 054-889-3347. NCLEX Swift, Accelerating Nursing Mastery. So what is NCLEX? NCLEX stands for the National Council Licensure Examination. This is a standardized test used to determine whether a nursing graduate is prepared to begin practicing as an entry level nurse. So that means that before you can practice as a nurse, you have to pass this NCLEX exams. We have two types of the examination. We have the NCLEX-RN, which is for general nurses, and we have the NCLEX-PN, which is for the vocational nurses. That's the nurses who went to school for 2 years. And if you did your program for 3 years and another 4 years, then you qualify to write the NCLEX-RN. So who can write NCLEX? So a graduate from an accredited nursing and a midwifery program. And before you can sit for the NCLEX exams, you have to apply through a regulatory body. They will issue the pin to you to practice. So you have to apply to them first. Okay. So you have to go through a verification process. After the verification process, they'll give you the ATT, then you go and write your NCLEX exams, and then finally you call yourself a USRN when you pass the examination. Okay. So we'll take you through the steps involved in the NCLEX process. All right. So the nursing exams, which is the NCLEX-RN, okay, primarily focuses on a general nursing practice, which is medical surgical, pediatrics, psychiatry, and obstetrics. These five areas, medicine, surgery, pediatrics, psychiatry, obstetrics, that's maternity. So if you did all these five programs, then you qualify to write the NCLEX exams. Okay. So let's move on with our questions. Number of questions to answer on the examination day. So on the examination day, you are supposed to answer a minimum number of 85 questions and a maximum of 150. If you are applying to the RN or PN, you will still answer the same question. It doesn't matter. Okay. The test reports will be issued, I think, within 48 hours. Yes, you should get your results. Okay, your quick results. Right. So the test uses what is called the computer adaptive test, the CAT system, meaning that the difficulty of the NCLEX examination increases when you are doing well. Okay, it adjusts based on how you perform on the exams. So that is the CAT system for you. Okay. Hmm. Then location of the examination centers. For those in Ghana like this, we usually go to South Africa, Kenya, India. You can also go to the Philippines. If you are in the UK, you can go to London and then also take the test there. If you're already residing in the US, then you can take it in any of the 50 states in the US, or Canada, you can take it in any of the province. Okay. But that does not mean that we don't have centers in other places. We have centers worldwide because the test is administered by Pearson View. Okay. Our next question: is there an age limit to write these exams? The answer here is no. As long as you have the knowledge to sit for the NCLEX exams, you are good to go and write this test. Okay. Countries that require this license, let's say you want to go and take the NCLEX and want to know which country accepts this NCLEX exams. So one, you can use it in any of the 50 states in the US, any of them: Texas, Maine, Colorado, California, any of them, any of the 50 states, Massachusetts, any. You can also use your NCLEX exams in Canada, any of the province. You can use it for endorsement in Australia and that of New Zealand. So that means that you can practice your nursing in all these countries. Okay. All right. So what are the benefits of writing the examination? One, eligibility to practice as a registered nurse in highly developed countries. Remember the country that we spoke about. You can practice your nursing there without any hindrance. Secondly, access to better career opportunities and a higher pay. You'll be well paid for your service. Okay. You can specialize in any of the nursing specialties you want to do. You can. Okay. And the third one is increased global mobility in a nursing career. You can move to Canada, you can move to USA. If you are tired of those places, you can say, okay, let me go and explore in Australia. You can move to all these areas. You can move to any of the 50 states in the US because you hold a pin. All right. The fourth one says recognition as a qualified nurse and a competent nurse. So before you can practice nursing in these areas, you have to show them that you have the knowledge to practice the nursing that they have in there. And how do you do that? By showing them that you have a past NCLEX exams. Then, do we need an English score before we sit for the NCLEX exams? The answer is no. You don't need an English score. You don't need to go and write IELTS before you can write the NCLEX. However, there are some licensing boards that will require you to have your IELTS before you take the test. So before you select any of the nursing boards, okay, any of the nursing boards, you have to make sure that you meet their requirements. And lastly, can midwives from Ghana write NCLEX? Yes, you can write the NCLEX exams if only you did the 5 major courses that we spoke about in school. If you are from a qualified, let's say, a recognized nursing and midwifery institution, and you've offered a program that has all the 5 areas: medical, surgical, pediatrics, obstetrics, and that of the last one, the fifth one, okay, you can equally go back and then go and look at it. If you've done all these courses in school and the number of hours is equal to that of the US, yes, you can go through the NCLEX process and also have a pin to work in these areas. So what about those people who don't qualify or they don't meet the educational requirements? Let's say you have a missing course. What you have to do is to do those missing courses. Contact the universities and they will help you or assist you go through some of these missing courses. Okay. Then last, if you need anything related to the NCLEX exams, you can subscribe to this channel for more of your educational content. Okay.